medial aspect elbow joint with the patient seated and the elbow flexed and the forearm supinated. The examination is performed by moving the foot from the anteromedial to the posterior medial part of the elbow joint. This is like a reverse praying position. Flexed tendon attached to the medial condyle of the elbow joint, which is from the lateral of the forearm to the medial. Ultrasound examination of the flexed tendon on the medial side of the elbow is performed by rotating the foot in a pan shape with the medial condyle as a center in the following order: pronator teres, flexoscopy radialis, palmaris longus, flexor distal superficialis, and flexoscopy latalis. After checking the flexor originated from the medial side of the elbow joint, the medial collateral ligament is examined. The foot is tilted 45 degrees from the medial side of the elbow joint toward the posterior of the forearm. The anterior band of the medial collateral ligament and the humeral ulnar joint can be observed. In static images, if the humeral ulnar joint is observed to be less than 2 mm, it is normal. When performing a valgus stress test in the elbow joint, if the humeral ulnar joint space more than 4 mm or increased more than 2 mm compared to the contralateral side, damage or instability of the medial collateral ligament can be diagnosed. Ulnar nerve. The ulnar nerve emerges from the eighth cervical in the first serration nerve roots, branch of the medial cord, and runs along the medial aspect of arm to the posterior medial aspect elbow joint. After passing through the deep part of the ossibone retinaculum between the medial condyle of the humerus and the olecranon of the ulna, and passing through the arcuate ligament between the humeral head and the ulnar head of the flexoscopy latalis. The ulnar nerve travels along the deep part of the flexoscopy latalis muscle to the ulnar part of the wrist joint. The ulnar nerve may be entrapped on the posterior medial aspect elbow by the arcado-extruded ossibone retinaculum, arcuate ligament, and posterior ulnar recurrent vessel and the unconeus epitrochleus muscle. Dynamic testing should be performed to determine whether there is instability of the ulnar nerve. While flexing the elbow in the extended position, place the probe between the medial epicondyle of the humerus and the medial surface of the ulnar olecranon. If the probe applied pressure, instability of the ulnar nerve cannot be detected, so care must be taken not to apply the pressure. Instability of the ulnar nerve can be observed when the ulnar nerve is displayed to the anterior part of the medial condyle of the humerus, while from the extending to flexing the elbow joint. It should be checked whether snapping triceps syndrome is present.